Waking up with blurry vision is difficult enough, but for patients managing glaucoma, the morning routine often comes with a highly specific frustration, trying to distinguish between multiple tiny medication bottles and the constant fear of missing your eye when applying the drops. Today, we are going to fix that. By the end of this video, you will have a foolproof, color-coded organization system and a physical technique to apply your drops perfectly without your hands shaking. To follow along and build your system, you'll need to gather a few items: your prescribed eye drops, some large print index cards, a thick marker, and a sheet of multicolored dot stickers. Taking proactive, organized control of this daily routine is the single most important step you can take to prevent permanent vision loss. To understand why, we need to look at how fluid moves through your eye. Glaucoma is a group of disorders characterized by increased intraocular pressure, or IOP. Over time, this elevated pressure causes the optic nerve to atrophy. This diagram illustrates the eye's anatomy like a plumbing system. Aqueous humor fluid is continuously produced by the ciliary body, acting like a running faucet. It flows into the anterior chamber, normally exiting freely through the trabecular meshwork, which acts as the drain. This animation shows what happens when that drain clogs. When the rate of fluid inflow is greater than the rate of outflow, it backs up. The internal pressure rises, pushing backward and physically compressing the retinal nerve fibers. Several factors increase the risk of developing this blockage, including advancing age, a family history of glaucoma, and underlying conditions like diabetes or cardiovascular disease. Because the resulting damage to the optic nerve is permanent, mechanically or chemically lowering this internal fluid pressure is the sole objective of all glaucoma treatments. The first line of defense is drug therapy. Medications like beta blockers or prostaglandins manage the pressure by either decreasing the amount of fluid produced or helping the drain open wider. This animation illustrates a surgical option used when medications fail: argon laser trabeculoplasty. Laser pulses target the trabecular meshwork to physically widen the gaps, allowing trapped fluid to pass through. Another procedure is a trabeculectomy. Instead of widening the existing drain, the surgeon bypasses it completely, creating a new opening that routes the fluid out to a subconjunctival space called a bled. If prior filtering surgeries are unsuccessful, doctors can use drainage implants. These are tiny open tubes implanted to permanently shunt fluid out to the episcleral plate. Regardless of whether your pressure is managed by a surgical bypass or daily eye drops, maintaining this artificial balance requires strict, lifelong adherence to your treatment regimen. This brings us to a practical paradox of glaucoma treatment. You are required to accurately read tiny print on medication bottles using eyes that have reduced visual acuity. To fix this, we are going to build a distinct, high-contrast visual schedule. Step 1 is organizing your morning medication. Place a bright sticker directly on the cap of the bottle. Then take a large print index card, write down your dosage, and place a matching colored sticker right next to the text. Now repeat this exact process for your nighttime medications, ensuring you use a contrasting color, like blue for the night bottle and its schedule card. This color-coded system bypasses the need to read tiny print. By matching the red cap to the red card, you eliminate the risk of medication mix-ups caused by low vision. Now that you have the correct bottle, you need to apply the drops. Shaky hands are the primary cause of missed drops, wasted medication, and accidental eye injuries during application. Start your setup by washing your hands thoroughly and tilting your head slightly backward. Here is the critical stabilizing technique. Take the hand holding the bottle and firmly rest the side of it directly against your forehead. Use the index finger of your free hand to gently pull down your lower eyelid, creating a small receptive pocket. Squeeze exactly 1 drop into that pocket, then close your eye gently to allow the medication to properly absorb. Physically anchoring your hand against your skull eliminates natural microtremors, ensuring a safe, precise dose every single day. You have now established a foolproof visual medication schedule and mastered the physical anchoring technique to apply it safely. While you manage this daily routine, you must remain alert for acute angle closure glaucoma. Sudden severe eye pain, halos around lights, or sudden nausea are ocular emergencies requiring immediate medical intervention. Make sure to maintain regular eye examinations through dilated pupils so your doctor can track your exact internal pressure over time. Existing glaucoma damage cannot be cured, but by mastering this daily medication routine, you are empowering yourself to actively protect your remaining vision for the rest of your life.